We have Catherine CVA with AARP and Steve Edmonds with Alliance Insurance Services answering your Medicare and other health insurance related questions. Catherine, this person says, will Medicare insurance be going back up to $174?
We don't know for sure, but it's looking like it is going to stay at the rate that it is or decrease slightly. That's the latest news on the street, and that was $164.99 last year.
Okay. Steve, this person says, I heard that once you get an Advantage plan, it's very difficult to get off of it once you change your mind. Is this true?
No. No, you can, if you have an Advantage plan and you want to apply for what we call a Medicare supplement, which a lot of times is considered a lot better coverage, you can always apply for a Medicare supplement. The trick is most companies are not going to take you under a Medicare supplement if you already have a lot of pre-existing health problems, if you have heart problems, if you have cancer, diabetes. A lot of these sort of things might disqualify you from getting a Medicare supplement. Everybody can get the supplement at age 65. It's a free entry then. But if you go on an Advantage first and then 10 years later you want a supplement, you are subject to medical underwriting. You can get it, but you're subject to medical underwriting.
So it's better to get that supplement early on.
If you want a supplement, I would recommend probably doing it when you first turn 65. Yes.
Okay. All right. Catherine, this person says, why can I not have any other insurance if I have TRICARE military insurance?
You can have other insurance, but if you choose to not take your TRICARE, you have to go into the regular market and pay for it like anyone else will. If you are retired and are on Medicare, then you move into TRICARE for Life, which then becomes your secondary policy and acts like a Medicare supplement.
Mm-hmm. Okay. This person says, please explain the donut hole for medications, what it is and how to afford it. Steve?
So the donut hole is a lengthy topic, but just a really quick summary on it. When Medicare is calculating these drug costs, they look at how much you are paying for your copays, plus how much the insurance company is coming in behind you and paying for those drugs. When the total annual cost of your drugs get up to $4,660, that is when you technically enter the donut hole. Before then, you're just paying your simple copays for every time you get a prescription. Once you go into the donut hole at $4,660, then you have to pay more. Your copays will increase, they will go up. You stay in the donut hole from $4,660 up to $7,400. Then if your drugs exceed $7,400, you enter a catastrophic phase, and then your prescription copays go way down. Then so it's 3 phases: initial coverage phase, coverage gap phase, catastrophic phase.
Okay.
So it's 3 of them.
All right. Catherine, this person's asking, how do I find a Medicare doctor easily? I'm in Greensboro.
Most physicians in our area do participate in Medicare. The easiest way is for you to call their office, and as you're setting up a new patient appointment, ask them if they accept Medicare. I think one of the biggest challenges that we're all seeing is that a lot of folks aren't taking new patients, and that may be part of the challenges you've got, is that they're just not taking a new patient, and you may have to do a little bit of hunting.
Mm-hmm. And maybe that is even worth calling whatever the main line is to say who's taking new patients and going that way instead of calling each doctor's office. Call a Cone, call an Atrium Health, call a whatever, the main line, and see how they can direct you.
Great advice.
Steve, this person says, is it legal for all these insurance people to call you trying to sell Medicare stuff?
Probably not. For Medicare Advantage type coverages, an insurance agent is not supposed to call you at all. They can mail you stuff, they can email you things, they can set up booths and kiosks at events. So they can market a lot of different ways, but they shouldn't be directly calling you, no. Now, for Medicare supplement insurance plans, they can call you for those. So yes, they can call you and solicit a Medicare supplement insurance plan. They're not supposed to be calling you on Medicare Advantage, not at all.
You know, just because someone calls you and they say this is a good deal, you can take down all the information. You do not have to do anything and make a decision right there on the spot. You can look at it, you can think about it, you can call somebody else and find out about it. You don't have to do it right then and there. I think that's something that we all feel like we get, you know, under the gun, and we have to like actually make that decision.
Right. Talk to people that you know and people that you trust.